Sudden fever, severe body aches, and debilitating fatigue. If you've ever felt like you were hit by a truck in just a matter of hours, you've met influenza. The 1918 Spanish influenza virus is one long-lasting and brutal outbreak, significantly shifting America's attention toward expanding the public health system, helping to develop vaccinations and modern health protocols, establish emergency hospitals and clinics, and prioritizing future medical and scientific research. When the 1918 influenza pandemic hit, the US and the rest of the world were consumed by World War I. The overcrowded conditions and tight-knit troop movements on land, ship, and in the trenches created the perfect breeding grounds for the virus. The influenza virus lasted from 1918 to 1920, so around a year. Despite the nickname the Spanish flu, researchers believed influenza to have originated in the United States. One of the earliest recordings took place in Fort Riley, Kansas. The virus was transmitted by birds and pigs attacking the nose, throat, and lungs of humans. Black feet were a common sign that the person was beyond saving, as well as blue-tinted skin. Deaths were estimated to be around 675,000 in the U.S., causing the life expectancy to drop 12 years. The influenza virus obtained multiple nicknames, including Purple Death, which comes from victims who turned cyanotic, which means stopped breathing, and their faces turned a dark blue or purple color. Spanish Lady was coined due to wartime censorship, as Allied forces and Central Powers amassed huge losses, and warring parties stifled reports to hide information. Thus, uncensored newspapers in Spain reported deaths from the flu, left many to believe it had originated there. And despite being proven false, the name stuck anyways. Many survivors went on to give first-hand accounts of their experience with the worldwide pandemic. Edna Register Boone was a 100-year-old resident of Mobile, Alabama. Her family was one of the only in Mobile who did not contract influenza in 1918. Her parents became nurses, and she helped serve soup to the ill. Agnes Gatlin recalls many people in her community who were deathly ill and bedridden. Annie Laurie Williams, as a young girl, her father was infected by the flu and became very ill. Gertis Robinson was a 97-year-old resident who recalls, "It wasn't just one family that was affected, it was entire community." American labor and the economy was heavily impacted as well. In Arkansas, business declined between 40 to 70% and lost $10,000 a day on average. This increased the demand for beds, mattresses, and cots. Sadly, the only reported increase of activity was at the drugstore. In Memphis, Tennessee, industrial plants were running under a significantly small amount of workers. 124 of 400 men in the transportation department were incapacitated in one day, and local coal miners reported a 50% decrease in production. Many states experienced an increase in minimum wage, and it was reported that cities had higher mortality rates compared to urban areas. A labor shortage in manufacturing created a demand for workers as well. The influenza created an outburst of medical research. Studies suggested that pregnant women who were exposed to influenza gave birth to children with medical problems such as schizophrenia, diabetes, and strokes. It was noted that children born in and after the 1918 pandemic were more likely to be subject to physical disability, reduced educational achievement, and lower income. Massive improvements were made in the field of vaccinations as the pandemic exposed the lack of effective treatments and causes of influenza. Scientists began examining the small bacteria using electron microscopes to chemically identify the particle makeup and causes and genetic code, DNA. Because of the rapid growth and lack of nurses, the pressure to develop better public health measures and institutes was needed. One of the measures taken was quarantining. In response to the rapid spread of influenza, the public health system implemented social distancing, gathering bans, and school closures for all age groups. Communities that were able to minimize the interaction in public spaces lost fewer people, and methods such as isolation, ventilation, and disinfection were imposed for infection control. The lack of understanding surrounding health safety influenced health education. Modern methods of journalism, advertising, and entertainment were used to promote health safety measures, and to elevate living conditions, they trained Americans to take measures such as a good mouth, hand, and nose hygiene. Another product of the pandemic was the construction of health institutions. Previous to the 1918 pandemic, there was no real access to health care for everyone. Only the wealthy who could afford personal doctors. Lack of vaccinations and healthcare access left people to rely on home remedies like herbal concoctions. A lack of understanding and distrust in medical advice created a barrier, and many patients chose to ignore public health warnings or avoid seeking help. Face masks were implemented to reduce transmission. Visiting nurses, public health nurses, Red Cross, and Blue Circle nurses delivered care in the community. Cities, schools, theaters, and places of worship were all shut. Influenza highlighted the need for organized population-level health responses. It spurred researchers to map, sequence, and study the virus. Health protocols we use today were established for future pandemics. Emergency clinic centers and hospitals have been built all over the U.S. Social change was also an important factor in the 1918 outbreak, as it left a lasting scar. Anxiety and trauma surrounding the flu created a lasting impact and fear of germs in America. Young adults' deaths altered the workforce considerably in manufacturing, which made a way for women to be more involved and seek better job opportunities. Ultimately, the 1918 pandemic was not only a historical event, but the foundation for understanding and developing stronger health institutions, vaccinations, and pandemic preparedness. The failures to detect influenza early on revealed that preparedness requires healthcare access for all, trustworthy health education, and consistent communication. There's a children's saying that goes, "I had a little bird and its name was Enza. I opened the window in influenza."